One of the most common reasons blood sugar rises overnight in seniors is a natural process known as the body's early morning hormone response. While it may feel like blood sugar is spiking for no reason, the body is actually following a built-in survival mechanism that becomes more noticeable with age. During the night, especially in the early morning hours, the body releases hormones such as cortisol, growth hormone, and glucagon. These hormones are designed to prepare you to wake up by increasing energy availability, and they do this by signaling the liver to release stored glucose into the bloodstream. In younger adults with healthy insulin response, this extra glucose is handled smoothly. Insulin is released efficiently and blood sugar remains relatively stable. In seniors, however, insulin sensitivity often declines. The body may not respond as quickly or effectively to rising glucose levels, allowing blood sugar to climb higher than expected while you are still asleep. This can happen even if your blood sugar was within range when you went to bed. The liver plays a central role in this process. Overnight, the liver acts as a glucose reservoir, releasing sugar when the body signals a need for energy. As insulin resistance increases with age, the liver may release more glucose than necessary, or continue releasing it longer than it should. Because you are asleep and not burning energy through movement, that glucose remains in the bloodstream, leading to elevated morning readings. This process is often misunderstood because it is not caused by eating sugar during the night or making a mistake with food choices. Seniors are frequently surprised to see higher morning numbers after a careful dinner and a calm evening. The rise happens internally, driven by hormones rather than diet alone. Stress hormones are particularly influential, and even subtle sleep disruptions can amplify their effect. Poor sleep quality, frequent nighttime waking, or anxiety can increase cortisol release, further raising blood sugar levels. Another factor is timing. The hormone-driven glucose release typically occurs in the early morning hours, often between 3 a.m. and 8 a.m. Because this happens gradually, there are usually no symptoms to alert you. By the time you wake up and test your blood sugar, the increase has already occurred, making it seem sudden or unexplained. Many seniors blame themselves when they see these readings, assuming they failed to manage their condition properly. In reality, this is a physiological response that becomes more pronounced with aging and changes in insulin function. Understanding this removes unnecessary guilt and shifts focus toward managing the body's natural rhythms rather than fighting them blindly. Doctors often emphasize that recognizing this overnight pattern is the first step toward improvement. Blood sugar patterns are shaped by hormones, sleep quality, liver function, and insulin response working together. When these systems lose balance, even slightly, the effects can appear most clearly in the morning, especially in older adults whose metabolic flexibility has gradually declined over time. If you check your blood sugar first thing in the morning and feel confused, you're not alone. Many seniors go to bed with numbers that seem reasonable, only to wake up and find their blood sugar unexpectedly high. It can feel frustrating, discouraging, and even a little frightening, especially when you believe you did everything right the day before. Most people assume overnight blood sugar spikes happen because of something they ate or because they missed a medication, but doctors are seeing a different picture. In many cases, these morning spikes happen even when dinner was light, medications were taken correctly, and nothing unusual occurred the night before. What's important to understand is that the body does not shut down while you sleep. In fact, overnight is one of the most active times for hormone regulation, liver glucose release, and metabolic adjustment. But for seniors, these natural processes can become less predictable with age. The result is blood sugar rising quietly during the night without any warning signs. This is why so many older adults say the same thing: my numbers are fine during the day, but mornings are always high. It's not imagination, and it's not a personal failure. Aging changes how the body responds to insulin, how the liver releases stored sugar, and how stress hormones behave during sleep. These changes can happen slowly, making them easy to overlook. Another challenge is that overnight blood sugar spikes often don't cause immediate symptoms. You may sleep through them without realizing anything is happening. By the time you wake up, the numbers are already elevated and the damage may already be done. Over time, repeated morning spikes can increase the risk of nerve damage, fatigue, inflammation, and difficulty keeping blood sugar stable throughout the rest of the day. The good news is that understanding why this happens gives you control. Overnight blood sugar rises are not random. They follow patterns And once those patterns are recognized, there are practical steps that can help reduce them. Small adjustments to evening routines, sleep timing, and morning habits can make a meaningful difference without extreme dieting or drastic changes. In this video, we'll break down why blood sugar often rises during the night in seniors, what's happening inside the body while you sleep, and what you can do to wake up with more stable numbers. If morning readings have been a constant struggle, this information may help you finally understand what's going on and how to respond in a way that supports your long-term health. Another important reason overnight blood sugar rises in seniors is related to what happens in the evening, particularly the timing and composition of the last meal of the day. Many people focus only on what they eat, but when they eat can be just as influential. As the body ages, its ability to process glucose efficiently in the evening often declines. Insulin sensitivity naturally drops later in the day, meaning the same meal that causes little impact at lunchtime may lead to prolonged blood sugar elevation at night. When dinner is eaten late or contains a high amount of refined carbohydrates, the body may still be digesting and releasing glucose well into the night. This keeps blood sugar elevated for longer periods while the body is at rest. This physical activity typically decreases in the evening. There is less opportunity for muscles to absorb glucose, leaving more circulating in the bloodstream. Over time, this pattern can contribute to higher fasting blood sugar levels in the morning. Portion size also plays a role. Larger evening meals require more insulin to manage the incoming glucose. In seniors with reduced insulin production or insulin resistance, this demand may exceed what the body can comfortably supply. As a result, glucose remains elevated longer than intended, overlapping with the body's natural overnight glucose release. This overlap can compound the effect, pushing morning blood sugar levels higher than expected. Another factor is the balance of nutrients in the evening meal. Meals that are heavily skewed toward carbohydrates without sufficient protein or healthy fats can cause quicker spikes and slower declines in blood sugar. Protein and fats slow digestion and help stabilize glucose release, but many seniors avoid them at dinner due to digestion concerns or appetite changes. This imbalance can quietly contribute to overnight instability. Snacking habits before bed can further complicate the picture. Even small snacks, especially those containing sugar or refined carbohydrates, can trigger insulin responses late at night. While the intention may be to prevent low blood sugar or improve sleep, the effect can be prolonged glucose release during sleep hours. Because these snacks are often viewed as minor, their impact is rarely considered when reviewing morning blood sugar reading. Sleep itself also influences how evening food affects blood sugar. Poor sleep quality can reduce insulin sensitivity and increase stress hormones, making it harder for the body to regulate glucose during the night. Seniors who experience frequent awakenings, discomfort, or irregular sleep schedules may be especially vulnerable to this effect. What makes this issue challenging is that the connection between dinner and morning blood sugar is not immediate or obvious. The cause and effect are separated by several hours, making it easy to misattribute the rise to something else. Many seniors believe their morning readings reflect only what happened overnight, not realizing that the evening meal sets the stage for how the body manages glucose while they sleep, particularly when metabolic responses have slowed with age and become less forgiving of timing and balance issues. Another factor that often contributes to overnight blood sugar spikes in seniors is reduced physical movement in the late afternoon and evening hours. As the day winds down, many people become more sedentary, spending extended periods sitting, watching television, or resting. While this feels appropriate after a long day, limited movement late in the day can affect how the body handles glucose during the night. Muscles are one of the primary places where glucose is stored and used. When muscles are active, they absorb glucose from the bloodstream more efficiently, reducing the amount that remains circulating. In seniors, muscle mass and responsiveness often decline with age, making regular movement even more important for maintaining glucose balance. When physical activity drops off completely in the evening, the body has fewer opportunities to clear excess glucose before sleep. This becomes particularly important after dinner. If glucose from the evening meal is not adequately absorbed by muscles, it remains in the bloodstream as the body transitions into sleep. Overnight, when activity levels are at their lowest, the body has limited capacity to correct this imbalance. The result is elevated blood sugar that persists into the early morning hours. Another issue is that prolonged sitting can increase insulin resistance. Even short periods of light movement can improve insulin sensitivity, but long stretches of inactivity can have the opposite effect of seniors who may already have some degree of insulin resistance. This effect can be amplified. By the time bedtime arrives, the body may be less responsive to insulin than it was earlier in the day, allowing blood sugar to rise more easily overnight. Evening movement does not need to be strenuous to be effective. Gentle activities such as walking, stretching, or light household tasks can support glucose regulation. However, many seniors avoid movement in the evening due to fatigue, joint discomfort, or fear of disrupting sleep. While rest is important, complete inactivity can unintentionally contribute to metabolic imbalance during the night. Sleep quality is also influenced by evening movement. Light activity earlier in the evening can improve sleep depth and duration, which in turn supports better blood sugar regulation. Poor sleep, on the other hand, increases stress hormones that raise blood sugar levels. Seniors who remain sedentary throughout the evening may experience more fragmented sleep, compounding the effect on glucose control. What makes this factor easy to overlook is that it does not involve food or medication. Many seniors carefully monitor what they eat and when they take their medications, but underestimate the role of movement timing. Blood sugar regulation is influenced not only by what enters the body, but by how the body uses it. When muscles are not engaged before sleep, glucose remains available in the bloodstream longer than necessary. Over time, this pattern can become routine. Evenings become associated with rest, while mornings become associated with high blood sugar readings that seem unexplained. Without recognizing the role of late-day activity, seniors may continue adjusting medications or diet without addressing a key contributor. The body's ability to manage glucose is deeply connected to movement, and when that connection weakens with age, the effects often appear most clearly in the morning after hours of inactivity have allowed imbalances to quietly develop. Another reason overnight blood sugar rises in seniors is related to sleep quality and nighttime stress responses that occur without conscious awareness. Even when sleep duration seems adequate, the depth and continuity of sleep often change with age. Frequent awakenings, lighter sleep cycles, or difficulty staying asleep can activate stress hormones that directly affect blood sugar regulation. When sleep is interrupted, the body releases cortisol and adrenaline to maintain alertness and stability. These hormones signal the liver to release glucose into the bloodstream, providing energy in case the body needs to respond to a perceived threat. In younger individuals, this response is brief and tightly regulated. In seniors, the hormonal response may be stronger or last longer, leading to prolonged glucose release during the night. Sleep fragmentation can occur for many reasons: pain, discomfort, nighttime urination, anxiety, or even environmental factors such as noise or light can disrupt rest. Each disruption triggers a small stress response. While a single awakening may not have a noticeable effect, repeated interruptions can create a cumulative increase in stress hormone levels. This sustained hormonal activity can drive blood sugar higher over several hours of sleep. Another contributing factor is the timing of sleep. Going to bed very late or having an irregular sleep schedule can interfere with the body's natural circadian rhythm. The circadian system helps regulate hormone release, insulin sensitivity, and liver function. When this rhythm is disrupted, glucose regulation becomes less predictable. Seniors who nap extensively during the day or go to bed at inconsistent times may experience more pronounced overnight blood sugar fluctuation. Anxiety and mental stress can also play a role, even if they are not consciously felt during sleep. Worry, unresolved stress, or emotional strain can elevate baseline cortisol levels. These elevated levels may persist overnight, encouraging glucose release even in the absence of physical activity or food intake. Seniors often underestimate the impact of psychological stress on blood sugar, assuming that only diet and medication matter. Another overlooked issue is sleep-disordered breathing, such as mild sleep apnea. Even brief pauses in breathing can trigger stress responses and oxygen fluctuations that raise blood sugar levels. These events often go unnoticed, but can occur multiple times per night. Over time, they contribute to insulin resistance and increased nighttime glucose production. What makes sleep-related blood sugar spikes difficult to identify is that they happen silently. There is no clear signal during the night, and the effects are only visible in the morning readings. Seniors may blame food choices or medications without realizing that the underlying issue is how their body responds to sleep disruption and stress. Improving blood sugar control in these cases requires looking beyond meals and considering the quality, timing, and emotional context of sleep, especially as aging alters the way the body responds to nighttime stress and hormonal regulation. Another contributor to overnight blood sugar spikes in seniors involves medication, timing, and how the body processes insulin during sleep. As people age, the way medications are absorbed, distributed, and metabolized can change. What worked well earlier in life may not provide the same level of coverage overnight, even when doses are taken exactly as prescribed. Many seniors take diabetes medications or insulin during the daytime or early evening. By the time the body enters the deeper stages of sleep, the effect of those medications may be diminishing. This reduction can allow blood sugar to rise during the night, especially when combined with the body's natural hormone-driven glucose release. Because the rise occurs while sleeping, it often goes unnoticed until the morning measurement reveals higher than expected numbers. Insulin sensitivity also changes overnight. During sleep, the body becomes less responsive to insulin, meaning that glucose remains in the bloodstream longer. For seniors with existing insulin resistance, this nighttime reduction in sensitivity can be more pronounced. Even small mismatches between medication timing and the body's overnight needs can result in morning spikes. Another issue is consistency. Variations in medication timing from one day to the next can disrupt the body's ability to anticipate insulin availability. Seniors may take medications earlier or later, depending on daily routines, meals, or fatigue. While these variations may seem minor, they can affect how well blood sugar is controlled during the long overnight fasting period. Some medications may also interact with sleep patterns. Certain drugs can affect appetite, sleep quality, or hormone levels, indirectly influencing blood sugar regulation. For example, medications that disturb sleep can increase stress hormone release, while others may suppress appetite in the evening, leading to imbalances that show up overnight. Seniors often take multiple medications, making these interactions more likely. Another overlooked factor is fear of nighttime hypoglycemia. Some seniors intentionally reduce evening medication doses or eat extra snacks to avoid low blood sugar while sleeping. While this concern is understandable, it can sometimes lead to higher overnight glucose levels if not carefully managed. Balancing safety with glucose control becomes more complex with age, and small adjustments can have larger effects. The challenge is that overnight blood sugar patterns are difficult to interpret without careful observation. Morning readings provide only a snapshot of what happened hours earlier. Without considering medication timing, insulin sensitivity, and sleep-related changes, seniors may adjust the wrong factors. Understanding how the body processes medications overnight is essential for identifying why blood sugar rises during sleep and how timing and consistency influence long-term control, particularly when age-related metabolic changes make the system less flexible and more sensitive to small disruptions. Overnight blood sugar spikes can feel confusing and discouraging, especially when you believe you're doing everything right. The important thing to remember is that these changes are rarely caused by a single mistake. More often, they reflect how the body's rhythms, hormones, movement, sleep, and medication timing interact as we age. Understanding what happens while you sleep shifts the focus from self-blame to awareness. When patterns become clear, it becomes easier to respond with thoughtful adjustments rather than constant frustration. Small, consistent changes made at the right time can support more stable blood sugar levels and reduce morning surprises. Always discuss any concerns or changes with your healthcare provider, especially if you take medications or manage diabetes. This information is meant to help you ask better questions and better understand your body, not to replace professional medical advice. If this video helped you make sense of your morning readings, consider sharing it with someone who may be experiencing the same issue. And if you want more clear, practical guidance designed specifically for seniors, stay connected for future videos focused on understanding and managing blood sugar with confidence.